Okay, so let's start. Today we are going to discuss the two important topics. First one is the cortisol, and the second topic that we are going to discuss is ADH and the function and the disorders that are associated with the ADH. So first of all, we have to understand the normal regulation of this hormone. Whenever you are studying any hormone in endocrinology, first try to understand its regulation. Let's take an example. You have to know from which site in the body this hormone is going to produce. So first of all, we have to know this, like the site, you can say, or location. Then remember this point. Let's suppose any hormone, if it is producing in our body, there is always some kind of signals that can lead to specifically that hormone production. Like this cortisol is, for example, this cortisol is going to produce from adrenal gland. So this is the, you can say, site and location. But adrenal gland is not making cortisol by its own. There are some kind of signals that are coming toward the adrenal gland, and these signals can lead to the formation of, you can say, like cortisol and other hormone. So that's why we have to start from basic. We have to know the most important regulatory pathway, like from which this is going to produce. So here I like make a diagram. You can see it is the like a structure of hypothalamus, and below the hypothalamus we have the pituitary gland, and pituitary gland has two parts. One is interior and the second one is posterior. Please remember, the cortisol is not going to produce from interior pituitary, posterior pituitary, and hypothalamus. Basically, here the signals will come. That signals will go to the adrenal gland, and then the adrenal gland will start producing the cortisol. So first of all, first signal is basically CRH, and this CRH is going to release from the hypothalamus. So please remember this point. In the hypothalamus, we have different nucleus. The nucleus will produce the CRH. This CRH will go to interior pituitary, and in the interior pituitary again we have different kind of cells. You can say corticotrophs. Corticotrophs are those cells who are going to produce cortisol. So this CRH that is produced from the hypothalamus, it will go to the interior pituitary. In the interior pituitary we have the corticotrophs, and these corticotrophs are going to produce ACTH. So from the interior pituitary, you will produce ACTH, like your brain will produce ACTH, and this ACTH will go to the adrenal gland. Now, adrenal gland has two parts. One is the adrenal cortex, and other is the adrenal medulla. Adrenal cortex is further divided into three parts, like zona glomerulosa, zona fasciculata, and then we have zona reticularis. So these are the, you can say, different parts, and we have to know like from which part this cortisol is going to produce. So basically it is the adrenal cortex, but from the zona fasciculata. So please remember this point. It is going to produce from zona fasciculata. So this thing is also mentioned here, like the cortisol, its main source is adrenal gland. You can say adrenal gland cortex, and the part of the cortex is zona fasciculata. And you have to remember also there are like two signals. First signal is CRH and the second signal is ACTH. The first signal CRH will come from hypothalamus, and the second signal is ACTH, that will come from the pituitary gland, interior pituitary gland. Please remember this point. So this is the, you can say, regulatory pathway. This is called regulation. And now we have to understand, let's suppose in my body the adrenal gland make the cortisol, but how this cortisol is going to give signal to hypothalamus or pituitary gland, please stop making cortisol. Because in our body there are always, you can say, limits for each hormone. There are normal basic level. If in your body anything is going to produce in excess, your body will shut down its pathway. So when the cortisol is produced enough in the body, this cortisol will go back. It will go back to interior pituitary, it will go back to hypothalamus. And if it go back to interior pituitary, it will inhibit ACTH. If it will go back to hypothalamus, it will inhibit CRH. So basically it is going to lead to you can say negative regulation. It is also called a negative feedback. So please remember this point. We have like two kinds of feedback. One is the positive feedback, and the second one is the negative feedback. So positive feedback, basically you can say it is going to start from hypothalamus. Hypothalamus will give signal to interior pituitary. Interior pituitary will give signal to adrenal cortex, and that adrenal cortex will make cortisol. So this is the positive feedback. Positive feedback means you are going to make something, and when you have made that thing is going to like suppress the positive feedback, and that kind of feedback is called negative feedback. So please remember this point. Now you can take help from this diagram. Like this is the like hypothalamus, and from the hypothalamus you are producing the crh. This crh will come to the interior pituitary. Interior pituitary, after the interior pituitary you produce acth. This ACTH will go to adrenal cortex, and adrenal cortex has zona fasciculata. There it is going to produce cortisol, and this cortisol now you can say will go back, and it will lead to, you can say, negative feedback or downstream of cortisol, like production. So please remember this point. This cortisol will go back, and negative mean it is going to inhibit hypothalamus and anterior pituitary. So these are the important point. Now another very important point, we have to understand the situations in which our body is going to produce cortisol, because please remember this point. Whenever like any hormone is going to produce in your body, there are always some kind of signal. Like if the person is you can say under stress. So if the person is under stress, and also you can say your like circadian rhythm, basically your sleep cycle. So these are the two positive signals. These are the two positive signals which will go to hypothalamus, and when will hypothalamus receive these signals, it will produce crh. And this crh is going to like give, you can say, signal to interior pituitary. That interior pituitary will make will send signal to adrenal cortex, and that will make cortisol. This is the basically, you can say, loop pathway, and every pathway is regulated in our body with specific signals. So please remember, these are the stress and circadian rhythm. These are the positive signals which are going to, you can say, give signal to hypothalamus. That's why here it is mentioned by positive. So positive mean it is something producing, and if it is
Honey baby.
negative, so if it is something negative, please remember it is going to inhibit. So these are the important point you have to remember whenever you are doing any hormone in endocrine system. Please know these regulation pathways, from where it is going to produce, and after that you have to know like what are the signals that are leading to production of that hormone. So these are the important points. So these are the first 4 points. First one is hypothalamus, second interior pituitary, third adrenal cortex, and the fourth one about the feedback. Feedback are of two types, positive and negative. So I hope these things are clear to you guys. So this is about the, you can say, regulation. So you can also note these things on the book, because here they only mention the about the source. Before studying the source, you have to know the regulation, like how this source is going to produce that hormone. When you study the regulation source, then we have to understand the function. And please remember the function with pathophysicality. The first function of cortisol is increase appetite. I don't have to memorize this thing. I have to go in depth of this thing, how it is going to increase appetite, and on that you are going to be tested in exam. So please remember every function, pathophysiology or physiology, how it is going to produce, or how it is going to produce this effect. So cortisol, how it increase the appetite. Basically cortisol increases one neuropeptide. That neuropeptide is called neuropeptide neuropeptide y. Neuropeptide Y. This is the first thing you have to remember. Cortisol increases neuropeptide Y, plus it is going to modify the hypothalamic signal. So these are the two things basically which will lead to, you can say, when these two things are activated, it will stimulate the appetite. So this is the, you can say, exact mechanism you have to remember. For example, like when cortisol is produced in body, it will produce neuropeptide Y, and then it will go to the hypothalamus. There it will modify your, you can say, like hunger center. So when your hunger center is stimulated, you feel hungry and you start eating. So that's how it is like going to lead to appetite. And very important, like how, why cortisol is going to increase the appetite. This is another point. So whenever you are studying a function, first of all you have to know the mechanism. What is the mechanism behind this like function? Second thing, we have to know the reason by why cortisol is leading to increased appetite. What is the reason? So basically, in during, like cortisol is going to produce during stress. So during the stress, our body want more energy intake. So cortisol like is going to promote eating to restore the, you can say, energy stores. So that's why cortisol is going to, you can say, increase the appetite. Like in stress, your body need energy. That energy definitely comes from your food. So if you are not eating the food, definitely you are not going to you can say, you are not going to make energy. And if you are not going to make energy, definitely your body is not going to perform well during the stress. So this is the like physiology and reason behind this, how cortisol increase appetite. And the second important function is cortisol is going to increase the blood pressure. Then again we have to understand how the cortisol is going to increase the blood pressure. So first of all, please remember, just remember two important points. like uh, Whenever you are solving the UWord question or studying this first aid book, if it comes and like cortisol, it says cortisol is going to upregulate blood pressure, just remember two mechanism. Just remember these two mechanism. The first mechanism is the cortisol will go and it will regulate alpha 1 receptor. Now it is very very important. First of all, you have to remember where these alpha receptors are present. So let's suppose this is your peripheral artery. On the peripheral arteries we have smooth muscle. In the peripheral arteries we have smooth muscle. Let's suppose this is the smooth muscle. On these smooth muscles we have alpha 1 receptors. So when cortisol is produced, it will go to these alpha receptors on the smooth muscle. When these alpha receptors are stimulated, they will lead to smooth muscle, you can say, contraction. So that will lead to vasoconstriction, and when your blood vessel is going to constricted, it will lead to increased blood pressure. This is the first mechanism. Please remember this point. Like cortisol increase the like alpha adrenergic receptor, and if you have more alpha 1 adrenergic receptors, definitely you will have more vasoconstriction. And another very very important point, you have to remember like how this cortisol is going to interfere with norepinephrine and epinephrine. This is very very important, you will get in your word question also. Basically, alpha receptors are those receptors on which epinephrine and norepinephrine is going to work. This cortisol will go and this will give the signal to these alpha receptors, like when the norepinephrine and the epinephrine will come, please perform the function more. So basically it increase the sensitivity, it increase the function of these receptors. Like if you have cortisol and if you have these two hormone will go to alpha 1 receptor, and even if you have this hormone, this will go and help these receptor to know you have to increase the sensitivity. So basically it it is doing two kind of function. First function, it is going to increase the alpha 1 receptor. Second function, it is increase the sensitivity of these hormones. So if these hormones will work more on the alpha 1 receptor, you will have more vasoconstriction, and if you have more vasoconstriction, then definitely you have like high blood pressure. This is the first mechanism which is also like mentioned here. They said first of all, cortisol will go and upregulate mean this cortisol increase the transcription. It increase the transcription of alpha 1 adrenergic receptor. So if you have more transcription, it's mean you are going to make more alpha 1 receptor. This is called upregulation. It's mean it is going to increase that part. So if you have upregulated alpha 1 receptor on the arterioles, then definitely your norepinephrine and epinephrine sensitivity is going to increase. And when epinephrine and norepinephrine sensitivity will increase, this will lead to a vasoconstriction. And when you have vasoconstriction, your blood pressure is going to up. This is the first reason. Please remember this point. And the second reason, very very important point, we have like every hormone, uh, sometimes we have like few hormones in high amount, and sometimes the amount of the hormone is low. Let's suppose if you have the cortisol in high amount. So when you have cortisol in high amount, this cortisol will go and bind to aldosterone receptor. Normally, aldosterone receptors are going to accept the aldosterone because these are the receptor for aldosterone. But sometime if you have cortisol in too much like quantity or too much amount, this cortisol will go to these aldosterone receptor. And when this cortisol will go to these aldosterone receptor, then what will happen? So let's suppose this is the last part of the nephron. I will just make the last part, that is the collecting duct. So here is the principal cell. Please remember this point also. Aldosterone is going to work on principal cell. These are the principal cell on which we have the aldosterone receptor. So aldosterone will come. It will do two things. First of all, it will, let's suppose it is the lumen. This is the lumen on like from which from which side your urine is passing. So here the urine is passing, and you have to remember this. When the aldosterone will work, it will, you can say, absorb sodium from the urine. So it will absorb sodium from here, and it will push into the cell, and from the cell your potassium will go outside. So sodium come in and potassium goes outside. This is the, you can say, function of aldosterone. But definitely when cortisol will bind to these aldosterone receptor, if your aldosterone receptors are stimulated, they are going to perform the same function. So just remember, at high concentration, your cortisol is going to bind with aldosterone receptor, and when your aldosterone receptors are, you can say, activated, they are going to increase the absorption of sodium. And remember this point, whenever the sodium is coming into your body, it is going to increase the volume. Wherever the sodium will go, water will follow it. So just remember this, wherever the sodium will go, water will follow. And if the sodium is going, water is going with that, definitely it will increase to blood pressure. Now the very very important point, normally we have one enzyme, that topic we will discuss tomorrow definitely. Congenital adrenal hyperplasia, that is the topic. In that topic we will study, we have one enzyme that is called 11 beta HSD2. This is the, just remember this enzyme name, 11 beta HSD2. Basically, this is the enzyme which convert cortisol into the cortisone. SON. Listen, cortisol is active, cortisone is inactive. So if you have this enzyme will do, will convert the cortisol into cortisone, and it is the inactive, like you can say, substance. If it is inactive, it is not going to perform function. And we have to understand like how then it is going to bind to aldosterone receptor. So basically, when your cortisol is at high concentration, if it is too much, then it is going to inhibit this enzyme. Now listen, if your cortisol is high, your this enzyme is inhibited, then what will happen? Your cortisol is not going to convert into cortisone. So if it is not going to convert into cortisone, your cortisol level will go up, and when this level will go up, it is going to act like aldosterone. So this is the mechanism. Please remember this. Don't just try to memorize these points, because if you have to just memorize, then you can read first aid by yourself. You don't have to uh, to take these classes. So the purpose of this class is to like understand the every function very well. You have to understand the exact mechanism, because it is going to be appear in exam, and definitely when you solve the u-word you will see these things. So this is the second function. So just remember, when the cortisol will act like aldosterone, it is going to what will be the ending result? So basically it is going to, you can say, increase the sodium absorption. And you can say when the sodium will go inside, the water will follow. When the water will follow, it is going to lead increased blood pressure. And also please remember, it is going to cause hypokalemia. Why? Because when aldosterone work, it pushes the sodium inside and potassium outside from the cell. So this is the same mechanism. You have to remember, this is the second important function of cortisol. The third important function is it is going to cause insulin resistance. Now again, we have to go in depth of this like mechanism, how the cortisol is going to cause insulin resistance. So anyone from all of you want to tell? You guys, whenever I am asking question, you guys can turn on your mic, but otherwise please mute yourself, because this class is recorded. So any activity if you are doing, it may recorded in this session, and it is going to be like for toward many students. So that's why when you are taking class, sit like seriously, and try to like avoid the different works when you are taking this class. So any student want to like share how it is going to cause cortisol, like how cortisol is going to lead insulin resistance? What is the mechanism? You have to tell the mechanism, like how cortisol decrease insulin sensitivity in the tissue. Because if the insulin resistance will occur, your glucose will not go into cell, your glucose will not go into cell, your blood glucose will go up. So when your blood glucose will go up, you will develop the diabetes. So because this is the cortisol that is leading to diabetes, that's what is called diabetogenic. So this is the, you can say, easy definition, but we have to know the mechanism. So just remember, when you have cortisol, this cortisol will go to GLUT4 transporter. Like GLUT4 transporter, where these are located? Anyone from all of you? This is the second question which I'm asking. So whenever I am telling the topics in the like group for tomorrow, please try to have little bit knowledge on these topics, because you are going to participate in this class. Yes, you are right, these are present in skeleton muscle, these are present in skeleton muscle and adipose tissue. These are the two important sites, please remember. GLUT4 transporters are present in smooth muscle and adipose tissue. Now remember, if the cortisol will go and inhibit these transporter, what will happen? In smooth muscle and the adipose tissue will not get glucose. So your glucose is, you can say, going to be more in your blood. So your glucose uptake will increase, and sorry, your glucose uptake will decrease. When your glucose uptake will decrease, your glucose will stay in your blood, it will lead to diabetes mellitus. This is the, you can say, first mechanism. And the second mechanism, you have to remember, whenever the cortisol is going to produce in your body, it will go to the liver, and it will give the signal to the liver to produce more glucose, to increase the glucose output. So it is also going to liver, and it increase the hepatic glucose output. So these are the two important reasons how the cortisol is going to cause diabetes, or why we call it diabetogenic. So please remember these two important points. You guys have also studied in pharmacology, corticosteroids causing diabetes mellitus. How corticosteroid causing diabetes mellitus? This is the exact mechanism. Corticosteroid are going to increase the hepatic glucose production. Corticosteroids are going to inhibit the glucose translocation in adipose and muscle. So these are the similar mechanisms. So please remember these points. Then we have the next important function. Whenever you have cortisol, it is going to increase the gluconeogenesis. What is the definition of gluconeogenesis? Basically, gluconeogenesis is a process in which you are going to produce glucose from non carbohydrate resources. And what are those resources? Like you have amino acid. From amino acid, you can make glucose. This is an example of gluconeogenesis. So please remember this point. Like gluconeogenesis is a process in which you are going to make glucose from the non-carbohydrate sources. Example is like amino acid proteins. And the second is lipolysis. And lipolysis, basically, you have to remember what is lipolysis. You are going to mobilize or break down the free fatty acid. And when you will break down the free fatty acid, basically it is called lipolysis. Now this is not the only thing which have to know. We have to know the mechanism, how cortisol, you can say, increase gluconeogenesis. So basically, cortisol will go and it increase the production of different kinds of enzymes. Like we have a fructose 1,6 bisphosphate, bisphosphatase. Then we have glucose 6 phosphatase. So these are the enzymes which will lead to, when these enzymes are activated, they will, you can say, increase the production of glucose. So please remember these two enzymes in gluconeogenesis. Then what is the enzyme that is going to break down the fat. That is the hormone sensitive lipase. Hormone sensitive lipase is going to be stimulated by cortisol. So remember this point. Then it is going to increase proteolysis. What is proteolysis? Basically, you are going to break down the protein. So just remember this. And when you will break down the protein, what will happen? What are the side effects that can be, you can say, that can occur when the cortisol is going and it is breaking down the protein? So basically you have to remember, like if the cortisol is too much, it will go to your muscle, it will break down the sorry, it will go to the it will go and break down the proteins, and if the proteins are break down, your muscle cannot use these proteins, so you will get the muscle wasting. So that's why we will study next, like these patients, especially who have high amount of cortisol, their muscles are going to be like wasted, and their extremities are going to be thin. So this is the reason why their extremities are thin and why their muscles are wasting, because of proteolysis. And then next we have basically what is the meaning of glucose utilization? Here they just only mention this point, but we have to again go in detail of this topic. So how cortisol is going to decrease the glucose utilization? So please remember two or three things. First of all, cortisol reduces glucose uptake in tissues. First of all, it will inhibit the GLUT4. So when your GLUT4 is inhibited, you will not, you cannot take the glucose, so it is going to decrease utilization. Then it will compete with insulin. This is the second reason. It will compete with insulin. And the third thing, it is going to block the insulin pathway. So if you block the insulin pathway, again definitely your muscles, your tissues are unable to utilize glucose, because insulin is the thing which will enter the glucose into the cell, and if you inhibit the insulin, then that tissue is not going to utilize. So this is the mechanism why glucose utilization is decreased. So please remember these concepts, like whenever you are studying this. And then next sixth point is, this cortisol will go and decrease the fibroblast activity. Now, again, we have to understand this thing. Like whenever you have high cortisol, this cortisol will go and decrease the fibroblast activity. What is the function of fibroblast? The function of fibroblast is to make collagen. And let's suppose the function of fibroblast is to make collagen. If you inhibit the fibroblast, you are not going to make collagen. What will be the result? Your skin will become thin. You will get the poor wound healing. You will get easy bruising, like you have a bleeding points on the skin, and you will get the purple stripe. This is very very important. Why in the diseases in which you have high cortisol, your body is going to get like purple stripe? We will study next that thing in topic. So if there, like it is going to be mentioned, then the what is the mechanism? Basic cortisol inhibit the fibroblast, your collagen synthesis will decrease, then your skin will become thin, you will get poor wound healing, you will get easy bruising, and that will lead to purple stripe. So just remember this point. And then we have it is going to decrease the inflammatory and immune response, and this is again going to be very very important. That's why cortisol is called anti-inflammatory, and it is also called immunosuppressive. It is called anti-inflammatory and immunosuppressive. So first of all, just remember, whenever you have cortisol, it will go and inhibit the two important things. First of all, it will inhibit the leukotriene. Second, it will go and inhibit the prostaglandin. So when you inhibit the leukotriene and prostaglandin production, so how it is going to it is going to inhibit the leukotriene and prostaglandin production. Basically, we have one enzyme. That enzyme is called phospholipase A2. This phospholipase A2 break down the arachidonic acid. This arachidonic acid will go into leukotriene and prostaglandin production. Basically, this cortisol will go and inhibit the phospholipase A2. When you inhibit the phospholipase A2, then you cannot convert the phospholipid into arachidonic acid. So, if you cannot convert the phospholipid into arachidonic acid, then you cannot make leukotrienes and prostaglandin. So, this is the exact mechanism. Like here, they just mention it will inhibit the production of leukotriene and prostaglandin. You have to know the exact mechanism. First of all, it will go and inhibit the phospholipase A2. When phospholipase A2 is inhibited, it will go, when phospholipase A2 is inhibited, your phospholipid is not going to convert into the arachidonic acid. And if you cannot make the arachidonic acid, you cannot make leukotriene and prostaglandins. So this is like the important, you can say that's why it is called anti-inflammatory, because it is going to inhibit the synthesis of leukotriene, prostaglandin, thromboxans, etc. Then the second is it is going to inhibit white blood cell adhesion. First of all, we have to understand the term adhesion. What is adhesion? So let's suppose this is the blood vessel, and here the endothelial cells. So these are the endothelial cells which are present inside your blood vessel. And we know that in blood vessel, basically our blood is present. And what is inside the blood? Over a different kind of cell like a neutrophil, macrophages, different kind of immune cells. So it is the here let's suppose neutrophil. Neutrophil has three loci. So basically, neutrophil. So basically, how it is going to happen? If you have adhesion signals, like we have LFA1, just remember this signal. This is the signal which will help the neutrophil to bind with this endothelium. So let's suppose when you have cortisol, this cortisol will go and it will decrease the production of this signal. If you have less this signal, then your neutrophils are not going to adhere to this endothelium. So it's mean your neutrophils will stay in blood. So if your neutrophil will stay in blood, your neutrophil count will go up, which is called neutrophilia. So that's why they mention here, like it inhibit the white blood cell adhesion. If you inhibit the white blood cell adhesion, your white blood cells are going to stay in blood. They will not leave the blood. Let's suppose in case of inflammation. In case of inflammation, we need neutrophil to the site where the inflammation is going. We don't want like they will stay in blood, because we want to kill the bacteria. We want to finish the inflammation. Sorry, and that's why if they are not going to come outside, they will stay in blood, and when they stay in blood, they will lead to neutrophilia. So this is the like important point you have to remember. So this is the like another, you can say, anti-inflammatory uh, kind of, you can say, the function. And then it is going to block histamine release from mast cell. This is again like a very important point we have to remember, like how it is going to cause this. So basically, this cortisol will go to the mast cell, and it will inhibit the mast cell to release histamine. So just remember, like if you have less histamine, then what will happen? You have less vasodilation. Basically, histamine is a, you can say, molecule that is going to produce the vasodilation, that is going to dilate the blood vessel. So if you have like less, if you have less cortisol, if you have less histamine, then your vessels are not going to be dilated. So you have less vasodilation. And if you have less vasodilation, it's mean your blood is not going to like come outside of this blood vessel. So just take an example. This is the blood vessel, and after the let's suppose I like give a substance, that substance will go and it dilate the blood vessel. So when your blood vessel is dilated, definitely you can say it is going to allow the things to leak out, especially in case of inflammation. I am like telling all these things in case of inflammation, because in case of inflammation we want neutrophils to come outside. Otherwise we don't want in a normal person that the neutrophil come outside and they will produce substances, that those substances will damage our own tissue. We just want only in the inflammation or infection. So basically, during the inflammation we also need histamine, because if you have histamine, definitely it will vasodilate. And if you have vasodilation, your blood, your more like neutrophils will come. If you have more neutrophils, they are coming more toward the inflammation side. So basically, it is going to inhibit the histamine release from mast cell, and when it inhibit the mast cell histamine, you will get like less vasodilation. And if you have less vasodilation, you have less like capillary permeability, and that will lead to like reduce allergic response. That's why in the especially when the cortisol is high in your body, you are not going to get allergic response. This is the reason like why people get less allergic response when the cortisol is high, because your histamine is blocked. Your histamine is blocked, then definitely you will not get the allergic response. Then it is going to cause eosinopenia and lymphopenia. First of all, what is eosinopenia? Where you have decreased number of eosinophil, and basically this cortisol will go, and you can say it causes the apoptosis. Apoptosis means it is going to cause the death of cell. So if your eosinophils are going to die, their count is going to be less, so it will lead to eosinopenia. Then it is going to cause lymphopenia. What is the meaning of lymphopenia? Again, it is going to cause the death of lymphocytes. So just remember these 2 points. Like it will decrease the, you can say, circulating lymphocyte, and it will also decrease the eosinophil. So these are the important points you have to remember. Then we have another function. It is going to block interleukin 2 production. First of all, we have to know why interleukin 2 is important. Then we have to know if it is blocked, then what will happen. So basically, interleukin 2 is important. You can say especially for T cell activation. Like in the inflammation, we want our T cells to be activated, because if they are activated, definitely they are going to suppress or inhibit the source of infection or inflammation. So if you have more cortisol, this cortisol will go and block the IL-2 production. If you can say if your IL-2 is blocked, your T cell is not going to be activated. Your T cells are not going to be proliferated. So if your cortisol suppress interleukin 2, it's mean your T cells are suppressed. You are not going to proliferate or stimulate T cell. And what happen in immunosuppression? Same thing happen in immunosuppression, like your T cells are suppressed, your immunity is suppressed, your immune cells are suppressed. So that's why this cortisol is also called like immunosuppressant, because it is going to block the interleukin 2. When you block the interleukin 2, your T cells are not going to be proliferated, stimulated, and their function is suppressed. That's why it is also called immunosuppressant. So this is the reason. Then very important, this cortisol will go and decrease the bone formation. So again we have to go in detail. First of all, just remember, when you have high cortisol, this cortisol will go and it inhibit the osteoblast activity. So basically, we have to know the mechanism exact, because here they just only mention definitely when your osteoblast is not working, you are not going to make bone, because osteoblasts are the cells which are going to be help in bone formation. Osteoclasts are the cells which are going to help in bone breakdown. So basically, if you are talking about the bone formation, then we will pick the osteoblast. So if you are making less bone, it's mean your osteoblast are less working. But we have to know the mechanism. What is the mechanism? So basically, this cortisol will go, and you can say the first thing it will do, it inhibit the osteoblast proliferation. If the osteoblast proliferation is inhibited, then definitely you are not going to get the mature osteoblast or osteo, you can cells which are going to make bone. So if you are not proliferating the osteoblast, you are not going to allow these cells to make bone. Then the second thing is this cortisol will go and promote the death. It will promote the apoptosis of osteoblast. So if you are osteoblasts are going to be die, then definitely your osteoblasts are less and you will make less bone. This is the other. Then the very important point, it will increase the osteoclast activity indirectly. So please remember these 2 points related to osteoblast and 1 point related to osteoclast, because next we have one disease which is called Cushing syndrome. In Cushing syndrome, basically what will happen, your cortisol is high and your patient will get osteoporosis. And they can ask how the patient is going to get osteoporosis. So this is the exact mechanism. Like if you have more cortisol, just remember 3 points. First point, it will inhibit the osteoblast proliferation. If you have less osteoblast proliferation, you have less osteoblast active. Second, it will you can say stimulate the apoptosis pathway. If you stimulate the apoptosis pathway, your osteoblasts are again going to be less. If you have less osteoblasts, you are going to make less bone. The third point, it will stimulate the osteoclast indirectly. That will lead to bone breakdown and you will get osteoporosis. So this is the like these are the exact things which you have to know when you study all this, because if you don't know these mechanisms, you can't understand the Cushing disease, the disorders which are associated with cortisol. So that's why I teach you guys first physiology, or like first you can say the important things related to physiology of cortisol. If you know these things, then definitely you can study well the disease part. And then they also, like here they mention the cortisol is going to bind to corticosteroid binding globulin. So basically, just remember these are the proteins which are produced by liver, and what is their function? Their function is bind to their function is to bind the corticosteroid, and cortisol, it is a like corticosteroid. Definitely, it is going to bind with these globulins. Then here they also mention exogenous glucocorticoid can cause uh, you can say exogenous glucocorticoid can cause reactivation of TB and candidiasis because it blocks the interleukin 2 production. Now, again, thing, just remember, if you want why interleukin 2 is important in our body, because this interleukin 2 is like you can say prevent the TB activation, and it also prevent us against the infection of candidiasis. So if you block the interleukin 2, you are not going to make granuloma. You are not going to make granuloma. Then your TB bacteria will spread because the granuloma is going to surround the TB bacteria. So if let's suppose this is the Mycobacterium tuberculosis, and here we have the granuloma. How this granuloma is going to produce with the help of interleukin 2. Now just imagine, if you don't have interleukin 2, you don't have this granuloma, then your Mycobacterium tuberculosis is free. It will go and reactivate, and it cause like severe infection. And the second thing, you will get the candidiasis infection, because interleukin 2 is also preventing us from the especially this opportunistic fungal infection which is called candida, which is caused which is called candidiasis, and it is caused by the candida. So just remember this point. This regulation part I already explained. Like CRH will produce from hypothalamus, it stimulate ACTH. From pituitary it will produce cortisol. This will be produced from zona fasciculata. If you have excess cortisol, it will inhibit the CRH, ACTH, and cortisol secretion, which is called negative feedback. So all these things I already explained. Then these are the important points, like chronic stress may produce a large amount of cortisol secretion, cortisol resistance, and impaired immunocompetency and dysregulation of HPXs. So it's mean, if you like, the stress is not good for our body. If you are going to get like more stress, you will get more cortisol. Okay, so please let me know these are give me a 1 minute break. I need to drink water. Then we will start.